We are going to begin this evening with the pre-submitted questions, and we will try to cover as many of them during the next hour. We have a team reviewing the questions that come up live on Facebook. With that in mind, I would like to begin by introducing tonight's panelists. SU's President, Dr. Fred Bustello, Interim Provost, Dr. Mike Lewis, Interim Vice President for Student Development, Dr. Deborah Lowy, Vice President for Diversity and Community Engagement, Dr. Jonathan Smith, and SGA's President, Joseph Resnikoff. Before we begin asking questions, I would like to give SU's 33rd President, Dr. Bustello, an opportunity to share some remarks on the opening of the academic year.
Thank you, Lydia. And thank you also to Joseph, the members of the Student Government Association, and all of our students who are attending today's town hall. And I appreciate my fellow panelists being here with me as well. I'm grateful for the many students who are involved in planning and executing move-in and the start of the term. Over the summer, we heard loud and clear from you that you wanted to be back living and learning on campus. We listened to countless stories of the challenges so many faced while trying to live and learn from home. Together, we worked hard and invested in order to make this fall's on-campus start a reality. It goes without saying that this is far from how I would have pictured the start of my 7th year here as president at SLU. But nonetheless, it is good to be back together and here with you virtually today. The past 6 years have been filled with amazing triumphs as we have made significant progress on our vision as a global Jesuit university, one that is mission-focused, student and patient-centered, research-driven, working with the people of St. Louis to reimagine, transform, and unite our city. I hear repeatedly from you that SLU feels like a second home, and that your peers, your faculty, your staff feel like family. Our alumni, the former students of St. Louis University, tell us stories of how well SLU prepared them for both life and work. This all warms my heart and is evidence of our living our mission. But all has not been easy, and there is much work ahead. Very early on in my presidency, Michael Brown and Vondert Myers Jr., son of one of our beloved employees, were killed in police-involved shootings. And the shared pain over the loss of Black and brown lives cut short, denied equal opportunity, or slighted in subtle or obvious ways continues on. There's much change that is needed on our campus, in our region, and across our nation on this pressing issues and many others. Let us not shy away from these challenges as we also deal with the demands of living and learning with the restrictions necessary during the pandemic. We also felt grief in the spring when COVID-19 forced us off campus abruptly. And when we watched the many people in our hometown communities and here in St. Louis suffer from or lose their lives to this disease. Now we are back. And while I feel optimistic of what this academic year will bring in terms of student success, research success, patient treatment, and the many other opportunities we have at St. Louis University to build individual and collective excellence, I also hear and feel your uncertainty. I want to speak specifically about our shared responsibility. I appreciate that some of you are feeling the weight of every single decision you make right now. And that feels like a burden. We all fear that if this does not go as planned, the blame will fall on us. Like Drs. Lewis and Lohi said in their message last week, we want to be in the headlines for being a school that got this right. But the burden weighs heavily on each member of SLU. If you feel that weight, as I do, as Joseph does, as Jonathan does, as the rest of us in this meeting feel, I want you to know that to me, it demonstrates that you care. Our shared awareness for the high stakes validates what I mean when I call us one SLU. But just as we share these burdens, we can also share in solutions. I am sure my colleagues will echo the sentiment tonight, but just as we are working to make sure that you have clarity around how to be safe in community together and enjoy your college experience, we need your creativity, your partnership. When you see opportunity, offer it to us. We are here to listen and adapt. We welcome students as partners in our search for solutions. We must join forces as one SLU to amplify our efforts. I honestly feel that we can make headlines for doing what our mission calls us to do. Higher purpose, greater good. We are one SLU. Thank you, Lydia.
Thank you, Dr. Priscillo. To get us started, I'm going to begin with some of the most asked questions we received in advance, many of which are about COVID-19. It will be helpful if we begin sharing how and why the university decided to resume in-person learning and instruction this fall. Dr. Priscillo, would you mind walking us through this decision and process?
Sure, I'd be happy to. It really began these discussions at the end of the spring, once we got through the spring term, and continued through the summer. And the discussions took place primarily in what we call the ULC, University Leadership Council. That's a group of about 45 people. It's been expanded since March. It includes the SGA president, my colleagues on the call, Dr. Smith, Dr. Lewis, Dr. Lohi, are all members. And we would meet weekly and talk about what is it that we need to do. And we frame that as by asking those questions: what is our mission? What are our values? What do our stakeholders expect of us? Our answers to those questions guided our decisions. We listened to our students and our faculty about the consequences of living and learning at home. We heard of the difficulties for so many of our students trying to live at home and do their classwork. We heard it particularly from first-generation students, students who had obligations to siblings and parents, demands of household on the internet, students who, for any number of reasons, had trouble with access, and students having problems being disciplined enough at home. So we knew that our students were facing challenges, that it was better to be on campus to live and to learn. So we listened to our students and our parents who said they wanted to open face-to-face. And some said they wanted the option of online. Flexibility was the key. Some were not comfortable returning or starting face-to-face. And we've done our very best to accommodate both, thanks to a huge investment of time on the part of our faculty and staff, and a large investment of money in getting ready for this. We've also consulted extensively with experts, both internal experts and external experts, and colleagues in our various respective areas at other universities. We planned, invested, and adapted. Many people gave up vacations this summer in order to work to get us ready to open. Let me ask Dr. Lowy if she'd like to speak a little bit about how our values and mission help guide our reopening.
Yeah, thank you, Fred. I think I would just add a couple of key things. So for me, I've been thinking a lot, and throughout this process, we were thinking a lot about students' mental health and well-being. What happens when students go home and are far away from the community that they had here? What happens when those inequities that you described, Fred, thinking about inequitable access to high-speed internet, inequitable access to technology, inequitable access to private space where you can be out if you are not out at home, or where you can connect with people that you or like you that you don't necessarily have in your family of origin home or the home that you call home when you're not here at SLU. We had extensive conversation about the fact that an on-campus experience is a leveler of many of the kinds of inequities that our students might experience from across a broad range of spectra. And those inequities get exacerbated when we send folks home. And in particular, access to healthcare and mental health care become much harder. If your mental health care provider is a counselor here at SLU and your permanent home is in a state where we don't have the ability to practice, right? There were just lots of students whose continuum of care was disrupted by that experience of not being in person. And then I just would say, so kind of equity and justice perspective, bringing students back seemed like a value that we were all really committed to. And agency was a value that we talked a lot about in our leadership team discussions, which is why we ended at a place where we gave people the agency to say, I don't feel comfortable coming back in person, or my health doesn't allow me to do that. I'm going to learn remotely, or I'm going to teach remotely for our faculty and other instructors. I will say, I think that level of agency and that level of variation in experience is not typical at many institutions because it's actually a lot harder to do and requires more time, more energy, more money. And I feel really grateful that our values and our obligations to our students were really high on the list of things that we considered when we were trying to make a decision about coming back. Just the last thing I would say, Fred, it's partly to the comments you made about shared responsibility. I think we all knew that coming back wouldn't look exactly the way it looked in, say, February of last year, or like any other typical first-year experience for new first-year students. I think we may have been, those of us in these leadership meetings week after week, day after day, probably had even greater clarity about what those differences would look like than many of our students did, or even our staff who've been working remotely. And I think it's been a bit of a hard shift for all of us to come back and not be able to give the hugs and the high fives and to not see faces. It's really hard not to see faces. And so I think we're all learning to adjust, and that's hard work for all of us. So I think honoring our values also means that we have to be honest about the grief and frustration and difficulty that also comes with, even as we're happy to be back in community.
Thank you so much, Debbie. I think this next one might be for Dr. Priscilla or Dr. Lewis. While recognizing all of the work to reopen campus, students are curious to know the circumstances which would cause the university to do a full pivot to remote instruction. Is there a number of cases or specific isolation value which would force our decision?
I've explained this question, in fact, in university-wide town halls. It's been asked by faculty and staff. There's not a specific number on a specific indicator that we have decided if we hit this number, we're going to pivot. We are constantly gathering information and data across a number of variables. Where's the community spread at? What's the number of hospitalization? How many people are in ventilators? What's the capacity? What are we seeing in terms of the spread among our population? What are we seeing in terms of capacity in our abilities to quarantine and isolate and so forth? We're in constant touch with experts, both on campus and off campus in the region, following closely and having conversations about parameters that are being set. So there's not a day that does not go by when we're taking assessment of everything. Thus far, we've been fortunate and things look pretty good, but we're continuing to monitor it. Again, there's not a single number that we say, well, when we hit this number of cases or this number of people being tested or what have you, that would trigger us to immediately make the shift. So Mike, anything you'd like to add?
Sure, thanks, Fred. The only thing I would add is to the part of the question that deals with full pivot to remote instruction, as I think I heard it. And I guess I would just prepare people that although I understand we've had one lived experience at this point of what it means to transition from being on campus to then to something else, something different. It was in the spring, and it was pretty much complete. We all evacuated very quickly, and we transitioned to an almost entirely online learning. And I guess I would just caution that it might not look the same way. So so we have the one lived experience. That doesn't mean that's the only path we could take. And so I do think people should prepare that if there is an eventuality, or, and I hope it's not an eventuality, but if there is a time that we do have to pivot to something different, we could have different strategies aimed at de-densification that we could consider. We have certain classes, for instance, that we are not offering online versions of, for instance, some labs, some fine and performing arts studio courses, some practicum type courses. We could have we could get to a place that, based on the considerations that President Costello noted, where maybe we move the lecture courses online, but we still do the other types of instruction face-to-face. So we've all experienced one pivot, but I do want to open people's minds to the idea that there are other ways we could do this, and we are thinking of those constantly.
Thank you. We have a slight shift in topics now, still COVID-19 related, but now regarding testing. Several students have inquired about SU's testing protocol, specifically wondering if the university has plans to release information regarding positive cases. President Costello, would you like to explain the university's plans for this?
Yeah, so we're fortunate at SLU to have a medical school, School of Public Health, and one of our areas of deep expertise is in fact in virology. We have some of the world's leading experts who are part of the clinical trials for the Moderna vaccine that we're immersed in right now. So we have a team at SLU led by an MD working to develop a dashboard that we intend to put out early next week that will be regularly updated as part of the critical information about COVID-19 cases at SLU. So we've been transparent about the data. We reported on testing after we tested all the incoming residential students. We reported on the testing of the non-residential students through our town halls. We continue to intend to update the community. And again, starting early next week, we will have a dashboard completed that we will update, because we think by sharing that data will be helpful to all members of our community, and we will continue to get advice from these experts. We now have a baseline. We know where we were at move-in, and we will be able to update from there. Debbie, do you have anything else you might want to add?
Yeah, I think 3 quick points. I know I'm not known to be quick, but 3 quick points. I think it is important to say that we have some tests pending. Our tests so far have a pretty high likelihood of coming back negative, so that our positivity rates have been very low, and I think that's really helpful information. The second thing I would say is at any moment, the number of active cases in our student health center are not necessarily on-campus students, so they may not be living on campus, they may be living off campus. And not necessarily isolating on campus. And then the last thing I would say is every day that there's somebody in isolation, there are often going to be people moving out of isolation and back into the campus community. So the positives are, on the number in isolation, are a snapshot in time each day. And the number doesn't always only just go up. It also can go down, right? As people move out of isolation, if new cases have not stepped into that gap. So that number is going to continue to fluctuate, and sometimes it will be up and sometimes it will be down at a given moment in time.
Thank you, Debbie. As a quick follow-up, Dr. Costello, there were many questions regarding the university's plan for continued regular testing throughout the semester. Is there a plan for SU to monitor potential cases through pool testing or clusters?
Yeah, so our team of public health experts continues to evaluate what the future testing protocol will look like for asymptomatic students. So there's conflicting and shifting recommendations about this at the national level. There's also a severe shortage of testing materials coupled with the inability of many testing groups to turn around tests in a timely manner. Here in the St. Louis region earlier in the summer, many of those who were doing testing were taking 5, 7, 10, sometimes 14 days to turn around the test results. By that time, they're not helpful at all. So we were fortunate to be able to find a lab to work with for the start of the term. And that came together, just a week or so before we were ready to begin, and we were working hard to get it and to get a lab that we thought would be reliable and we could count on. And we were very pleased with the results. Primary reason that some universities decided at the very last minute not to open is because of their inability to get testing. So we're assessing what's the best course forward. In the meantime, we continue to test students, faculty, and staff who contact, in the case of students and faculty, employee health, or in the case of students, student health, and appear to need a test. So this is clearly a priority for us. And as soon as we have more information about what asymptomatic testing will look like moving forward, we'll share it with the campus. If a student is experiencing symptoms, so if this would be symptomatic testing, a student has experienced any of the symptoms of COVID-19, the student should immediately contact the Student Health Center. I can give you that number. It's 314-977-2323. 314-977-2323. Call the Student Health Center and they will discuss the testing options. If you've been in close contact with someone who tests positive for COVID-19, you should also contact the Student Health Center. So if you're a student, you've been in close contact with someone who's tested positive for the virus, or you believe you have symptoms of COVID-19, immediately contact the Student Health Center. Now, for the purpose of SLU's contact tracing program, the following is the definition of a close contact. If you've been within 6 feet of an infected individual for 15 minutes or longer without both of you wearing masks, or you've had direct physical contact with the respiratory secretions of an infected person. For example, they've coughed or they've sneezed when not wearing a mask, regardless of the length of time or exposure, that's close contact. You need to call the Student Health Center. Thank you, Lydia.
Thank you, Dr. Costello. Many of you also submitted questions regarding the enforcement of the university's COVID policies and expectations. From mask compliance to off-campus social decisions, we're going to tackle a few of these issues now. To start, Dr. Lewis and Dr. Lowy, you sent the email to students last week challenging them to make positive social decisions over the weekend. Would either of you be willing to explain what might happen if a student is found to be in violation of these expectations? As outlined in the campus commitment, is it true that students could be fined or suspended for not complying with our public health safeguards?
I'll take this one, Mike, unless you can add at the end. I'm going to have a few different layers to this response because I think it's really important to have the context in mind. And there are a bunch of questions in that, and they all have slightly different answers. So let me start by saying that SLU has always had a set of community standards that students are asked to live by, whether they're on campus or off, whether it's the school year or they're at home, whether they're here or over on our Madrid campus. That set of community standards has a variety of possible sanctions, and the Student Responsibility and Community Standards Office has always taken a kind of mission-focused, educational-minded, restorative justice approach to violations of community standards. So that, I'll say a little more about that in a minute. So that's kind of the backdrop. Even before COVID-19, there were a lot of conversations about adding a new kind of charge in the conduct and community standards process, which is a harm to community charge. There were lots of reasons that we folks were feeling that we needed that kind of charge, because of a lot of the work that our conduct folks do is really focused on the impact of decisions made, right? It's not just it's not really even primarily a punitive body. It really is what happened and what were the impacts of that, and how do we move forward in a community-based way where we can do the work of restorative justice when we can. So that charge of harm to community was brought forward this year. It's in the new student the student handbook is updated every year. It's in the new student handbook. And things like compliance with COVID safeguards is certainly part of one of the charges for harm to community, right? Failure to comply is another very common charge in the conduct or community standards process, and it might be instituted for any number of reasons. So that's kind of backdrop. So are there conduct processes and sanctions related to non-compliance with COVID-19 safeguards? Yes. In many ways, what I would ask you to think about is the harm to community for an independent action in a non-pandemic time is quite different than the harm to community or the potential harm to community in a pandemic time. And so obviously those things matter. So then let's talk about the potential sanctions. I think it's important to know that I'm not trying to bury the lead. I'm trying to set context. So yes, fines and fees are already and have always been a part of certain kinds of violations in the handbook. Often those fines and fees are meant to have a restorative justice component because the funds that come forward from that either address the harm to community that may have been committed if damage was done, if an unauthorized pet created damage, if smoking in a room led to the need for additional cleaning, right? Or those fees for certain kinds of behaviors, typically around drug and alcohol abuse, might go into educational programs for students that are anti-addiction programs. So there's a kind of reciprocity where when there are fees and fines levied, they're used for the kind of greater good of restoring the campus community. So all of that is important to say. When I think about the potential sanctions for non-compliance, they run the gamut from a warning to the potential for suspension, the potential for expulsion, the potential for the revocation of a housing contract. Always when we come up with, when the conduct process leads to sanctions, those things consider a variety of factors: the student's willingness to take responsibility, the potential degree of harm to the community, whether or not this is a first, second, 28th offense, right? So there are lots of things that go into the question of which sanctions will get implemented at which moments in time. So I want to think for a minute about the specifics of COVID-19 compliance. Not wearing a mask, right? Stepping out of your residence hall room, running out to your car to get something, figuring, oh man, I left my mask. That's going to lead to a different kind of conversation if it gets into a conduct process. Then packing in lots of people into a very small space, drinking from a shared container, the beverage being consumed is alcohol, the people in the room are underage, right? Those things have the potential in a pandemic to explode the number of cases of COVID-19 if anybody in that mix is positive, right? So the potential harm to community there is quite different than forgetting your mask or, pulling it down for a minute, taking a drink of something. I want you to know that there's a range of possibilities here. Initially this summer, there were conversations in the conduct office about fines for violations for non-compliance, particularly for mask violations. And in a theoretical abstract moment, people thought, yeah, that might make sense. I think 2 fines have been levied so far this semester. Both are being withdrawn. And the conduct folks have decided a fine for first offenses in particular, especially when sometimes the reports that come forward are anonymous, just doesn't seem fair. And so I want you to just know that they're not going to be levying fines for those first offenses. I think it's possible that repeat offenses could lead to fines for the reasons that we've talked about already. So bottom line, no more fines for first-time offenses, a range of possibilities, including, I just want to say, potential interim suspension if the nature of the offense is egregious enough, but we don't yet know if it's really founded by evidence, an interim suspension can always result until we sort through the conduct process, if it seems like the person is actively putting the rest of the community at harm. That's a very long answer, but I think these are nuanced and complex situations. And I think the most important thing to say is that when these concerns come forward, two things to say. When these concerns come forward to student responsibility and community standards, first, they're taken on a case-by-case, context-by-context basis. That's important. There's no single way of adjudicating these. And the second thing I want to say is, I'm really grateful that students are bringing forward those concerns when they have them about their peers. And I say that because I don't think it's about policing behavior. I truly don't. I think it is about demonstrating our shared commitment and our shared love of this campus and wanting to continue to be here. And so we are asking our brothers and sisters and siblings and friends and colleagues and coworkers, everybody, not just students, to rise to the occasion. And I just think it's important to know that complaints and concerns do come forward through other means for staff and faculty noncompliance, and there are consequences to those things as well. So I don't want you to think this is just a student side process. Sorry that's long, but there are a lot of layers to that, and I think it's important to be clear about them.
Thank you, Debbie. Let's hear some student perspective about this topic. Joseph, what can students do to help encourage their peers to make COVID-safe decisions?
Thanks, Lydia. And thanks to all of you who are tuning in with us right now or watching this after the fact. I think one of the things that has worked best for me when it comes to my relationships with my friends is leading with compassion and letting that be the guiding force that's helping you understand the best way to act and the best way to live responsibly with our friends. For me, the negative reinforcement doesn't really do it. So it's the positive reinforcement. It's the spending time with someone, and when you do social distancing correctly, thanking someone for being able to engage with you in a productive way while being 6 feet apart or while wearing masks and things like that. So I would strongly encourage students to do some of that positive reinforcement and do some of that thanking, because it really can go a long way if you're someone who, or if you're with someone who maybe wasn't totally sure exactly how to navigate those waters. And then another big thing that I think Debbie and I may talk about in a little bit as well is some of the events that the university is hoping to offer, both virtual and any in-person things that might be within guidelines, plus any things that student groups or individual students would be able to host on campus outside that would be safe. So we're going to talk a little bit more about that, but would really encourage students to be sure to be informed about those policies and be able to plan activities and events that are going to be able to fall within our guidelines that would still be able to promote some of the community that we're looking for.
Thanks, Joseph. Another question for you. How would a student report or share a concern they have regarding compliance with the university's guidelines and policies? What should they do with this information?
Yeah, that's another good question, Lydia. So for me, sometimes it can kind of feel like you're being a snitch when it comes to some of these situations, but I think like others have touched on, it's really important to remember our shared responsibility to each other and think of it as in terms of being a community as opposed to you sort of trying to rat out another person. So we do have a hotline that you can call to report acts of noncompliance with university policy. You can find that number on our Back to SLU Fall 2020 page under the Fall Safeguards FAQs. You can also find it on the Return to Campus module under the classes, attending in-person classes section on that Return to Campus module. And there also are opportunities for you to submit those concerns anonymously online. So snitches don't always get stitches, especially during a COVID-19 time.
Thank you, Joseph. Dr. Smith, I'm hoping you might can help us with this next question. What is SLU doing to provide support for St. Louis, the St. Louis community, Black and Brown communities who are disproportionately affected by COVID-19 and will be further affected by the return of SLU students to campus?
Thanks, Lydia. I think perhaps the first way I'll get into that is to actually talk about our staff here at the university. So as we were making decisions all summer about whether or not to open, we worked very hard to discuss what the impact would be on our staff, particularly our Black and Brown staff. And our Black and Brown, the place where you'll find the greatest density of Black and Latinx staff members are in dining services, housekeeping, facilities, and groundskeeping. So we thought a lot and talked a lot about what it would mean for us to open. So I think the first way we wanted to think about that relative to Black and Brown people in the St. Louis community is to look here at home on our campus, because I think too often we don't fully or explicitly recognize and remember that our staff members live here year round. This is their St. Louis community. This is not a place that they come to and leave in 4 years. Many of the people you see cleaning up in your residence halls, emptying trash cans in our classrooms and administrative buildings are people who have lived and worked their full livelihoods here. So that for me was our first and most important concern, to think about what we could do to mitigate the disparate effects of COVID on that population. And so we were always talking, as soon as we started having conversations about how to open and how to consider what to do in the fall, we were seriously talking about it, and we made sure that we talked always about the disparate effects on Black and Brown communities. We started by trying to capture the data of what was going on in St. Louis through at our hospital, right? So that was a place that we started. Among some of the things that happened over the course of the summer that are specifically directed to our Black and Brown populations. I believe it was earlier this week, the Center for Service and Community Engagement partnered with the New North Side Baptist Church on the north side of the city to pass out PPE in North City. And so Reverend Burton approached us this summer, and we set up a partnership to have SLU students and staff assist with passing PPE out in that community. Also this summer, Dr. Daniel Blash, who is the Chief Diversity Officer at our School of Medicine, worked with community groups and church organizations to help set up as robust as possible telehealth and telemedicine opportunities and spaces in community centers and churches for people who didn't have access to internet or telemedicine opportunities at home. At another point this summer, we were really concerned with how COVID was affecting people who were experiencing homelessness. And on at least one occasion, we did work to help provide tents for people who are experiencing homelessness. And I think those are some of the first things that are just some things that come immediately to mind. And I also want to emphasize here, as Dr. Costello mentioned earlier, SLU is a leading, we are a leading institution when it comes to virology, and in terms of clinical trials for vaccines. Our team is a leading team, and I think we have to understand, given the disparate impacts of COVID on racial groups, on Black people, as opposed to other racial groups, and on lower socioeconomic classes, that's really important justice work. So I think we want to make sure that we have a broad vision of that.
Thank you, Dr. Smith. We also received several variations of questions expressing concerns about the university's guidance about in-person events. In general, students are feeling inconsistencies with things that they have observed on campus as opposed to what they understand the university's ban on in-person events. There were also concerns raised that without more campus-wide programming, students are left with limited options for socialization, which could cause them to turn elsewhere for entertainment, or worse, sit in their rooms feeling isolated and disconnected. Debbie and Joseph, could you provide any clarity to these concerns?
Joseph, I'm going to start, and then you're going to correct me when I go off track, because that's what you do. Yeah, a few things to say about this. I think one key thing to know that I'm learning just very recently is that it sounds clean to administrators to say events, and so no in-person events, and in-person meetings, if they happen, have to be 10 people or fewer. What has become very clear to me in recent days is that terminology matters, and that students heard, we can't do anything in person. Nothing, not even be together in the quad having social experience or playing frisbee, or gathering with members of our CSOs in a socially distant, masked way. So what I want you to know is I hear you that that's just a terminology problem. We thought certain things were clear that in fact were not clear, and so we don't have new decisions about the restrictions on events and meetings, but we are working on, I think there are about 25 students we've invited to offer feedback on a document that Joseph and Jackie and I and others have been working on to make explicit what we believed was implicit in our prohibition on in-person gatherings. So to give a lot more, it'll be long because you want a detail and I want to give it to you. So it will make very clear the kinds of things we think you can be doing this fall. It's not helpful to know what you can't do if you don't have other ideas. So that's one kind of thing to say. We're hoping by the end of the week, a much more clarity will be out for that. At the same time, we recognize two other pieces. Like, yes, we want you to have experiences, and I'm particularly mindful of new students on campus, or those who were new last year and had their year cut short. You may still be trying to find your community, and so no in-person gatherings might make that impossible. So the Student Involvement Center is going to be working on two big pushes. One is more virtual offerings to be sure that folks have ways to connect, and that includes our students who are learning remotely this fall. So we have to remember that we're not all here on campus. The other piece is that we are we're in the process of codifying a university process that allows for very limited but important exceptions to the no events policy, and that would be for outdoor events. So we still have space restrictions and in-person gathering restrictions that we are stuck with for a lot of reasons related to COVID-19, and I could say more about that. But I think it's important to know we're going to be looking at outdoor movie nights, like some things that have that cut across student organizations that really are about the one SLU student community, and creating some opportunities for students to get engaged in person, always with social distancing and masks, and that's one of the challenges for us. So one of the things that we're balancing. I'll say people have seen what I know I have heard from students are inconsistencies. I think it's important to say there was already a kind of unspoken exceptions process. So things that you've seen, organized gatherings, mass outdoors, that had permission, and there was a robust conversation and public health protocols and a lot of conversation about why that should be or shouldn't be allowed. So I'm thinking about any activity that is essential to our identity as a Catholic Jesuit institution, while we're still honoring the restrictions on social gatherings, right? There's a balance to be had. So what we heard really loud and clear from students is, we see that a few people have gotten exceptions. That feels like an inconsistency and an inequity. And so our response to that is we're working on codifying a process that would apply across the university so that we can be sure that we're being more equitable about that, and so that we can be sure that we're not overly taxing the resources of our campus, including those very predominantly Black, brown folks that Jonathan mentioned who are doing the lion's share of the riskiest kinds of activities, cleaning up after us, being in close proximity to us. So we can't have rampant events without putting more risk and pressure to them. And so we're really trying to balance a variety of things. I'm going to stop and give it to Joseph.
Thanks, Debbie. Yeah, I think for me, one of the biggest things that I've been spending a lot of time thinking about is how we can make a lot of these policies and guidelines and regulations, how we can turn those things into student language, because no student should be expected to comb through every university policy or read the policy about policies in order to understand how to build community on campus. Like that shouldn't be the way that it works. And I acknowledge and understand that it feels that way, and it is that way right now for a number of students. So one thing that SGA has been working on is trying to find ways that we can simplify some of this language and simplify some of the things that we're talking about so that it's digestible for us as students and as CSOs who, again, have really great intentions and want to be able to sponsor things that build community on campus, especially for our first year students, for our now second year students who had their first year at SLU cut short last year. To me, those groups are two essential groups that maybe haven't had a chance yet to find their community. So SGA is going to continue working on finding ways to make some of the policies and language more digestible for students. And if you are a student who is particularly passionate about planning some of these socially distant activities or planning some of these virtual activities, I really encourage you to consider applying to the Student Government Association, to apply to be a part of SAB and sign up to do some of those things, because we really are looking for students who are engaged and committed to being a part of these efforts.
Can I add one other thing? When I said we are working on some virtual and potential in-person events, I don't mean that old people like me are sitting around dreaming up things we think you would like to do. I just want to say for the record, we're talking about Student Activities Board and SGA members and others working with the Student Involvement Center to design and create opportunities for community building and connection that students want to have experience with. So I don't want you to think that Debbie Lowe is trying to decide what you would like to do. That would not be interesting to you.
Thank you, Joseph and Debbie. Students are also wondering what has been done to support the SUS employees as campus has reopened. Did employees receive special PPE, or have they been given additional health benefits due to COVID-19? Or for those with children who are in remote learning situations, are they able to continue their jobs? Dr. Postello, might you be able to respond to any of those questions?
Sorry, I had to unmic myself. Sure, let me start with that. So similar to our students, we provided all employees with face masks, and depending on where an employee works, they might have additional types of protective measures in place, such as plexiglass barriers in high traffic areas. So also early on, we added a bank of hours for our employees to tap into as they navigate working from home. In many cases with children, and we know that this is more important now as most local school districts have started back to class, and many are doing so remotely. So we have been and will continue to try to be as flexible as possible with our faculty and staff. It's also important to keep in mind, though, that many on the educational side don't always have front of mind that SLU is almost 50% on the medical side, 50% on the educational side. And so since spring, this has been a particular concern for our clinical faculty and staff. We've kept open on the medical side, particularly dealing with COVID positive patients. So I'm pleased to report that we have had very few infections among this group, our clinicians, and those that we have had have been largely due to community spread and not patient contact. And as I recently learned, not a single medical resident or fellow has tested positive for the virus in over a month. So that's an area where it's particularly important to make sure that we have the right protective equipment. Thank you.
Lydia, could I just add one quick thing? Some of that flexibility that Dr. Postello mentioned will result in fewer people being physically present on campus this fall. I think it's really important that students know that just because they might go to an office where normally they see a lot of folks and there's only one or two people there, it doesn't mean that our faculty and staff are not still here for you. And I don't want you to feel like out of sight is out of mind. So I know lots of folks are doing that work remotely and eager to connect via Zoom and will be connecting via Zoom. I think it's just important to say we are in a kind of reduced density on campus, but it doesn't mean that all those folks are not still chipping away at all the things that matter to you and available to you.
Thank you, Debbie. So we did receive some questions not related to COVID-19, and I want to ensure that we have time to address those tonight. The first one is related to dining hours on campus. On some evenings, like Fridays, there are no dining options available for meal exchange past 8 p.m. and grand dining closes earlier than it has previously. Is there anything that can be done to provide longer hours or service in one or more locations on campus? Dr. Loy, is this something that you could potentially address?
Yeah, it'll be a very quick response because I hadn't heard this concern until we saw this question come through. And so, you know, the limited hours are based on a variety of things, the ways that workload shifted for our dining colleagues when they have to serve all the meals as opposed to self-serve, right? So there are staffing challenges, a lot of pieces. But what I want to say is, like, I hear the concern, very committed to raising it with our Dine SLU partners and trying to get some clarity about it. And I also, I know we have the Food Advisory Board, and I believe the new chairs of that group met with our Dine SLU partners yesterday or last night. So that's another place to make sure you share those concerns. I'll do some outreach and see what I can learn about whether there's some flexibilities there. I'm sure we can find some middle ground. I just don't know what it is yet, but I'm committed to looking into it.
Thank you, Debbie. Another question we received was in regards to SLU's TRIO and SS program, who was recently notified that their federal funding would not be renewed. As a program which serves first generation and marginalized identities on this campus, how has the university considered how to continue to support these students and the program staff despite a loss of federal funding? Dr. Lewis, could you speak to this?
Sure, thanks, Lydia. This is something that I myself have just learned of recently. I think this has occurred quite recently, and at least has been finalized recently. We're committed to the students that are that the program is serving, and will continue to be committed to them. As far as the future of the program and how we're going, what this is going to look like, I need to work with our Vice President for Enrollment Retention Management. That's where this program resides, which is in my area. But that's where I am right now. This is something that I really have just learned of in the past few days. I wish I had more, but I need to learn more about it myself and talk with Kathleen about how we're going to continue supporting this.
Thank you, Dr. Lewis. We received a live question. I wanted to put it out there for Jonathan and Joseph to answer. What will SLU do to make sure our local community receive resources to support to deal with COVID-19?
So again, I think I refer back to some of the things that we did earlier this summer, but we are always willing to partner with any organization, external organizations, internal organizations, to ensure that any variety of things that need to happen relative to Black community, particularly Black and Latinx communities in St. Louis. So I don't have any other specific things to add to that right now. But we have, I think the work that Dr. Blash is doing out of the med school is going to be, in terms of telehealth medicine, is going to be one of the most important ways that we deal with that. I think this is also an opportunity for us to figure out how to do this work in a time where we also have to be concerned about being physically distant from people, and so that begins to complicate much of the work that needs to be done. I think I've been in some conversations recently about how to communicate better to marginalized communities the best ways of accessing the healthcare system, particularly in a time of COVID, because again, I think that's very critical. But any student who has any ideas, any student organization that wants to work on that, please do contact me. And if we don't do it out of my office, I'll make sure that we connect up with the optimal partner for doing a wide variety of work.
Thanks, Dr. Smith. I think the only thing I would add to that from the student side is that the Center for Service and Community Engagement has been working hard to find opportunities for students to engage with our local community, whether that's in person in a safe way or virtually. One example of the work that is already being done by SLU students is partnering with a local Christian church to deliver PPE in North City, sort of like Dr. Smith was talking about. So if you are a student who is interested in some of those in-person activities or some of those virtual activities, we have posted the list that the CSCE created in our SGA emails, and we'll continue to send that out because we know that engaging with our community is an essential aspect of what it means to be a Billiken.
Thank you, Joseph. As we wrap up this evening, I want to thank everyone for submitting thoughtful questions for our panel and tuning in to join us on the SGA Facebook page. If you submitted a question and we were unable to get to it tonight, SGA will be working to provide responses to those who have provided their contact information. To our panelists, thank you so much for taking this time to meet with and hear from our students. I'm going to give Joseph and President Pastello the opportunity to provide any final thoughts as we bring this to a close.
Thanks, Lydia. I really appreciate you moderating this for us tonight and appreciate all of our panelists for joining us. I just want to reiterate one other point one last time, is that students need to be a part of these conversations and these decisions that are being made, and everything that happens for the next week, for the next month, for the next 202 years. So if you are a student who is energetic about this and passionate about this and wants to be engaged in this, please consider applying to be a part of the Student Government Association. Our application closes in 5 days. So that's August 31st. And we've sent out that application via email, and we'll be sure to continue sending that out to you all. So thank you for those of you who submitted questions. Like Lydia said, we're going to do our best to continue to answer those that were submitted live today as well after the fact. So thanks again. And Dr. Pastello, you want to take it from here?
Thank you, Joseph. So I appreciate this opportunity to be with you and to share information. It's particularly important in these times that we have the ability to hear your questions and concerns and respond to them. That's why we held the 3 open town halls university-wide. Dr. Lewis and I met with the Faculty Senate yesterday. We're having this meeting today, and we're planning other sessions. We will continue to communicate through email as well as through opportunities like this. I appreciate my fellow panelists. I want to thank Mr. Resnikoff, who has been participating in the ULC, which has taken a lot of time, in addition to his running the Student Government Association, which I know in and of itself is a demanding job, not to mention his studies. So thank you all for submitting your questions. Thank you for joining us for this hour today. We are one SLU. We've gotten this far, and with a lot of work and planning, it's good to be together. Thank you.